All right, let's get right into it. There's this little device, right? It promises drug-free pain relief. And for decades, it's been at the center of a massive medical debate. So today, we're going to look at a landmark study that finally gives us a clear answer to the big question: does TENS actually work?
I mean, we're talking about half a century here, since the 1970s. Patients, doctors, scientists, everyone's been arguing back and forth. Is this thing, transcutaneous electrical nerve stimulation, or TENS for short, is it the real deal, or is it just a fancy placebo effect? You know, all in your head. It's been this huge, uncertain mess for so long, but now we finally have the evidence to settle the score.
So, you might be wondering, why was this such a puzzle in the first place? I mean, TENS is used by millions of people all over the world. But the problem was, for decades, the research was just a total mess. You had all these small studies and they were all saying different things. One says it works, another says it doesn't, and that confusion trickled down to everyone. Doctors trying to help their patients, even the big health authorities writing the official guidelines. The result? A whole lot of shrugging, inconsistent advice, and just a ton of unanswered questions.
Okay, so before we get to the big reveal, the breakthrough study, we really need to unpack this whole controversy first.
So first things first, what even is TENS? Well, it's basically a small, battery-powered device. A lot of them are handheld. You stick these little pads, the electrodes, on your skin, and it sends these gentle, controlled electrical pulses through them. And no, the goal is not to shock you. It's all about stimulating certain nerve fibers to, wake up your body's own natural pain-fighting system.
All right, so how on earth is this supposed to fight pain? Well, this is where it gets really cool. It's not magic, it's science. It's a process called neuromodulation. Let me give you a really simple way to picture this. Think of your nerves as a phone line that goes straight to your brain. When you're in pain, that phone line is just screaming, pain, 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 nonstop. So what TENS does is it dials into that same line and sends a totally different, non-painful signal like a gentle buzzing or tingling. This basically creates a busy signal that jams up the line, making it way harder for that original screaming pain message to actually get through to your brain.
But wait, it's actually even cooler than just a busy signal. TENS is more sophisticated than that. See, depending on the frequency of that little electrical pulse, it can actually activate different pain relief pathways in your body. So a high-frequency pulse triggers the release of one type of natural pain pillar in your brain, while a low-frequency pulse triggers another one. The very same pathway, by the way, that's targeted by powerful opioid medications. It's like having two different keys to unlock your body's own personal medicine cabinet.
Okay, so with all that background, let's finally meet the hero of our story. We're talking about a massive, game-changing meta-analysis that was published in the British Medical Journal. Its one big mission: to finally solve this TENS puzzle once and for all.
And when I say massive, I mean it. The researchers didn't just look at a few studies here and there. Nope. They went out and gathered every single credible trial they could get their hands on. The final number they analyzed, a whopping 381 individual clinical trials.
And think about this. Across all of those trials, the total number of people involved was, wait for it, over 24,000. 24,532 to be exact. That scale is just incredible. It gives the results a ton of weight, what scientists call statistical power, making them way, way more reliable than any single study that ever came before.
And their process for this was just incredibly rigorous. They started with a mountain of almost 8,000 potential studies and just systematically sifted through them. They threw out anything that wasn't designed properly, anything that was low quality, until they were left with only the absolute best of the best. I mean, this is truly the gold standard for how you do medical research.
All right, this is it, the moment of truth. After all that painstaking work, after 50 years of debate, what did the evidence from all 381 of those studies actually say?
The answer? It was crystal clear. When they pooled all that data together, there was no ambiguity. TENS provides significantly more pain relief than a placebo, a fake device that just buzzes but doesn't do anything. And this wasn't some tiny, barely there effect either. The analysis found a large, statistically significant result that pointed right at TENS.
And here's the really important part. This wasn't just a win on paper. The researchers found that the amount of pain relief was clinically meaningful. What does that mean? It means it's a difference that an actual person in pain would feel, a difference that would matter to them. So it's not just statistically better, it's real-world better.
What's even more amazing is that this result was consistent across the board. It didn't matter how they sliced and diced the data. Did it work for short-term acute pain, like after an operation? Yep. What about long-term chronic pain? Yep, that too. Back pain, fibromyalgia, you name it. It turns out the specific diagnosis didn't really matter, which suggests that TENS is working on a really fundamental level to manage pain, no matter what's causing it. And then there's the safety question, and this is a huge one. Across all those studies with nearly 25,000 people, guess how many serious side effects were directly caused by TENS? 0. None. The only things that ever popped up were really minor, like a little bit of skin irritation under the electrode pads, and even that was pretty rare.
The researchers who did this study, they didn't beat around the bush at all. Their conclusion was a straight-up mic drop. They wrote, and I'm quoting here, "This systematic review resolves long-term uncertainty about the efficacy of TENS." Boom. Just like that. After 50 years, the debate was finally over.
So, where do we go from here? What does all this actually mean? Well, this huge finding isn't just about answering an old question. It really feels like we're turning the page and starting a whole new chapter for pain management.
Because now, based on this rock-solid evidence, we have a really clear way to think about TENS. Number 1, it's a proven tool. It's not a placebo. It works. Number 2, it's incredibly safe. Number 3, it's best used as part of a team, as an adjunct treatment. It works with things like exercise and physical therapy. It's not a magic cure on its own. And number 4, you use it because someone is in pain, not because they have a specific diagnosis.
So if you remember just one thing, let it be this. The bottom line is that the science is finally clear. We now have good, solid evidence that TENS is a legitimate, safe, drug-free tool that people can use to help take control and manage their own pain.
And that leaves us with one last really important question to think about. For so many years, the official medical guidelines have been all over the place on TENS. Some were vague, others just dismissed it entirely, all because the evidence was so murky. But now that this huge study has finally cleared away all that fog, isn't it about time for the official guidelines to finally catch up with the science?